Pregnancy can be an exciting and stressful time, both physically and mentally. But imagine receiving a cancer diagnosis while being pregnant. That's what happened to one local woman. Giovanna Rodriguez Perez was 12 weeks pregnant when she found out she had acute myeloid leukemia.
When I first got diagnosed,
it's been a little more than 9 months since Giovanna and hematology oncologist Dr. Haifaa Abdulhaq first met. Giovanna and her husband were thrilled to finally be expecting after trying for a while. She says they were about to lose hope.
Right when we gave up, like, that's it, it's not going to happen for us, it did.
But her blood work showed something was wrong. Her OBGYN broke the shocking news.
He printed out my blood work and he wrote right there, acute myeloid leukemia.
Acute myeloid leukemia is an aggressive type of bone marrow cancer. Giovanna was referred to see Dr. Abdulhaq at the Community Cancer Institute.
You hear that word cancer and automatically you're scared to your bones, like nobody wants to hear they have cancer. That's the worst.
Dr. Abdulhaq explains acute myeloid leukemia is extremely rare in patients that are pregnant.
There are only a few cases in the literature about this diagnosis and treatment. We do know that we cannot give chemotherapy in the first trimester because that will lead to termination of the pregnancy.
Giovanna was presented with a few options.
I told her that we cannot give induction chemotherapy in the first trimester. So I gave her both options of terminating the pregnancy and starting chemotherapy right away after that, which is what probably many people would do in this situation. But also I gave her the option of keeping the pregnancy with close monitoring and providing supportive care with transfusions, protecting her from infections, and then waiting a few more weeks until we are in the second trimester where potentially we can treat.
Receiving chemotherapy even in the second trimester poses significant risks to both baby and mom. The treatment can cause patients like Giovanna to have low blood counts or become anemic, which negatively affects the fetus. But Giovanna wanted to keep her baby and chose to move forward with treatment in her second trimester.
For me, it was just, is the baby gonna be okay? Is my pregnancy gonna be able to go through the term and everything?
She underwent a total of 3 chemotherapy treatments while pregnant, and at 34 weeks gestation, Giovanna delivered a healthy baby girl via C-section.
So if it wasn't because I got pregnant and went to go see my OB, who knows when they would have caught this.
Dr. Abdulhaq says the new mother is cancer-free today, and it's because of the excellent multidisciplinary care offered through Community. Many healthcare workers had a hand in helping Giovanna through her cancer and pregnancy journey.
For treating acute myeloid leukemia, it really requires a team effort, including the oncologist, the nursing staff, the pharmacists, who are all well-trained and experienced in treating this disease. And then to treat acute leukemia in pregnancy, that requires way more support and even another level of multidisciplinary care, including the OBGYN team as well as maternal-fetal medicine.
Giovanna says she's grateful she was cared for by Dr. Abdulhaq and the entire team at Community. She can now focus on being a mother to the baby she always longed for.
I'm just grateful. I'm very blessed that Dr. Abdulhaq, she took a chance on me. She didn't just take one patient, she took 2 patients on. How can I pay her back for that? I'm very grateful with her.